Hang on. You're not Ian Morrison.
I'm not. He let me come back.
All right. Hang on, look, and we're together.
We're together. I went from being completely away and replaced to being right next to you.
Oh,
It's the March 1st episode of Health Tech Deals.
Okay, Jessica, where have you been?
Out in the wilds of Arizona.
You were lost, and then last week you were still lost?
Yeah, I was lost last week. That was when I was lost in Arizona.
I was pretty lost too. Yeah, no, it was the week before you were lost.
Hit some fantastic dive bars, hung out.
I thought you were hiking in mountains.
Yeah, that's
you were drinking in dive bars. Oh, well, yes, I was mostly sick in Tahoe. So
I see.
Yeah. So,
all right, we missed like hundreds of millions of dollars of funding deals, so we should probably jump to it. But hey, before we do, just big shout out and thank you to Ian Morrison for filling in. First ever replacement, Jessica.
I know. Still, well, I guess we should start with the ones we missed.
Let's go.
All right.
Couldn't believe this when this happened last week. Stopped me right in my tracks. Omada gets 129 million, brings their total out to a whopping 385. This is a Series E. I'm surprised. I was surprised they got this much money.
So I don't know. Sean and the guys there, have they missed the window, right? Because this is a big round. It's about 500,000 patients. They have increased the number of people they've got, a number of people on the system. They bumped up people doing more than just diabetes prevention to about 32%. So it's not just a diabetes prevention play, but it's still way behind. And right now they say Livongo is going to be marked down by Teladoc. So I'm not sure how big a deal it's going to be, but did they miss the window? We'll find out.
We'll see. All right. One company that's not missing the window, Somatus, gets 325 million. This is in chronic kidney care, brings their total up to 500 million.
Well, we're trying to figure out who's going to split out from the pack here with Somatus and Cricket and much others. And it looks like Somatus is doing it. What I'm not quite, they say they have 120,000 patients on the system, over 1,300 employees. What I'm not quite sure about is how much they are going to be doing, more dialysis. They were talking about doing more home dialysis. Now, how much are doing prevention? Because hopefully there'll be, but patients definitely need a better experience there because dialysis is miserable.
All right, hospital AI, just in time for Vive next week. 50 million goes to Qventus, brings their total up to 97.
Yeah, this is around from Thomas Lee, the private equity guys. Mudit Garg and his team there are figuring out this way to do internal AI stuff that improves hospital operations. We've had a lot of bunch of interviews with him. He was on a lot of conference. Interesting company, helping out hospitals to do better because they need to do better.
All right, what about Story Health? They get 22.6 million, brings their total to 27. This is their B round.
Yeah, this is kind of one of the sort of like doing heart failure management. There are so many of these companies doing different types of heart disease, heart failure management, not to mention that Livongo and others are also doing it. I'm not quite sure what this one means. Ex-Verily team. Hopefully I'll figure it out one day.
Medibuddy! What a cute name. 125 million, brings their total up to 192. They're based out of India.
Yeah, this is kind of one of those everything that you ever wanted to do, everyone wanted to do about digital health, including they've got their own sort of clinics, but they've also got telehealth, and they've got labs, they've got this, that, and the other, and it's everything online, new services in India. 125 million sounds like a lot for an Indian company because that presumably puts their valuation up pretty high. But I understand it's got a lot of people, big market.
Yeah.
Who knows? But there's clearly still, even though we joke about digital health and it's happening here, and everyone this week saying, "Oh, telehealth is now down again because it's not really happening," and blah blah blah. There's still a massive transformation of the healthcare system going on out there, and slowly, steadily, it's picking up in other countries.
I'm excited to go talk to people at Vive. Get that hospital crowd, find out what's really going on in there with the virtual care and the remote monitoring and the
if you
extension to the home.
If you look on TCB yesterday, I did an interview with Be Well Connected Health, which is selling kind of a bit like Seekster, or not like Seekster.
No, not like Seekster.
Who knows what the hell Seekster?
I got already closer than he's ever been before, though.
Explaining what it is, maybe. Anyway, but the upshot is that they are providing a digital front door. Appointment booking, connection, whatever, full consumer system to MedStar Health, which is one of the big hospital systems in DC. There are going to be a ton of people at Vive trying to figure out how to sell this digital stuff to hospitals to get the hospital, kind of like Qventus in this one, to get the hospitals up the curve of being slightly more efficient and slightly more user-friendly. not something the hospitals are very good at. They're very good at building new hospital wings.
They are.
Ritesh Patel is doing a whole thing about innovation hospitals at Vive, and I said, he says 3 hours, come and see. I said, if you find 3 hours worth, you're doing well. But I was being cynical, but I did find him 3 very quickly while he was, castigating me. I found 3 examples of hospitals spending $1 billion plus on building new hospital buildings. They're still good at that.
No, omni-channel. Remember, that was the word from health. I want to hear about the omni-channel strategy at Vive. That's what I'm going
$1 billion to the building, 25 cents to the chatbot.
Whatever.
All right.
We'll see. Yeah. If you're headed to Vive, let us know. I'm over there at Jess DaMassa, and he is at BoltyBoy on Twitter. You can find us there. Are you going to be publishing a party list? Usually you publish a party list.
Yeah, there's one on Monday night, which I invited you to already.
Yes, on the party list.
I think that's M Disrupt, who should be putting on a good party.
Well, everybody's invited.
Given all the money I gave him to... Oh, hang on.
All right, well, find us there. And to never miss an episode of Health Tech Deals, subscribe for the email newsletter over there at thehealthcareblog.com. You'll get these episodes and all the content from the week delivered directly into your inbox whenever we feel like sending that sucker out.
It'll be ramping up soon because
ramping up.
We didn't have a lot of content last week because you were off. I was sick.
We're a mess. Whatever. We've regrouped. We're coming back stronger and better than ever.
We will see many of you at Vive. Looking forward to seeing you.
Yeah, can't wait. We'll talk to you guys soon. Take care.